Hello and welcome to Goa 365's Face to Face. Now with me is Dr. Shekhar Salkar from Manipal Hospital, Chief of Oncology there. We have been in touch with Dr. Shekhar for a long time. COVID time, he's always been there for us. So today we have brought him to give us a general overview on the health situation and his specialty, which is cancer. Doctor, welcome to our show.
Thank you.
Doctor, now you are not, I know you are head of oncology, that's your specialty, but what I wanted, before we get off into the cancer part of it, in which Goa, there's a lot of it, what is the general situation, general health situation in the state at this present moment?
See, we have controlled totally the communicable diseases like diarrhea. People used to die of diarrhea and then fever and other things, infection, pneumonia. Those things have gone down drastically. Even बाकीचे सगळे जे आमचे म्हणटाले आमी डेंगू बेंगू सुद्दां जरी आतां थोडे वयर आयले तरी इट वॉज मच लेस कंपेर्ड टू द ओल्डर इयर्स. बट आवर नॉन कम्युनिकेबल डिसीजीस जे आसा लायक हायपरटेन्शन, डायबिटीज, कॅन्सर एंड ऑल दीस थिंग्स दे आर ऑन द रायज. That is because overall the life expectancy of the people has increased. See, like I'll give you example in 1947, suppose independence at that time our average man and female also is to survive only for 45 to 50 years. Baila 45 years and Dadle 50 years. Today our average has gone to 70 years. So we have added around 20 years to our life. And which has 20 years later part of their life. So as you grow old, you are going to have some sort of diabetes, hypertension, cancer. They will never come down. Only thing, there are changes of some cancers may go down, some cancers may come up. Then what? Like cervical cancer, cancer of the uterus, which has gone down drastically because it has become now number 2, and number 1, the breast cancer is rising. So breast cancer has come up. So this is up and down, will be over a period of about 20-30 years is normally happening. So I feel, and plus amche diet has become like a Western diet totally. I think we have like chicken and fish, and suppose amche the fish bhi kasle khatle 8 disache fish khatle adun fridgean davartale and that fridge mai parte ugadtale. Not fresh fish. See, if you eat fresh fish, fresh chicken, it's good, but it doesn't happen because time na loka. Husband is working, wife is working, nobody पहिली कशें आशिल्लें आमचे जाणटेलो बिणटेलो तो पोती घेवन बाजारान वतालो नुस्तें हाडपाक. ते वॉकिंग 1-2 किलोमीटर वचप, थंय मातसो असो पळोवप सारकें नुस्तें हाडप, सामकें जोखून बिकून हाडटाले म्हणजे सामकें फ्रेश आसा ती याची कल्ली काडून पळोवपाची तें आसा सारकें तुजें तांबडें दिसता काय ना तें. सो वी यूज्ड टू ईट आनी तें सांजचें सोंपतालें सगळें नुस्तें. तें केन्नाच दुसऱ्या दिसा सेम नुस्तें दुसऱ्या दिसा आमी केन्नाच खावं ना. हें आतां आमचें सुरू जालां बिकॉज टायम ना कोणाक. आयतारा तूं गेलो मार्केटान, यू ब्रिंग ऑल द फिश एंड ऑल सगळे ते मागीर सोमार मंगळार बुधवार अशें ते पाटे घाले आनी ते इल्ले काडून ते खावपाचे. सो वॉट एवर सेड एंड डन अबाउट द फ्रीज, यू आर ओपनिंग इट 100 times a day. उदक जाय, हें जाय, तें जाय. सो इट मे नॉट रिमेन द बेस्ट फिश एट दॅट टायम. सो दीस थिंग्स आर गोईंग टू गो. आनी प्लस आमचे ऑल दीस न्यू थिंग हॅमबर्गर आनी हें आनी ते व्हडले महाराजा जंक फूड इज ऑन द रायज न्ही. आनी तूं फोन केलो कोणाकूच घरा न्ही फ्रेश करपाची गरज ना. फोन केलो ते झोमॅटो बिमॅटो तूं काडून घरा दितात. सो फ्रेश प्रिपरेशन जे आसता दॅट इज नॉट हॅपनिंग. सो यू वील गेट ऑल दीस थिंग्स फॉर डिसीजीस. डायबिटीक, वी आर नाव इंडिया इज सपोज टू बी कॅपिटल ऑफ डायबिटीस. Goa is the first leading state in the diabetes.
Really? This I was not aware.
After the age of 40, our average means 40% will be diabetic. 40%. So every alternate man may be diabetic, maybe over a period.
Maybe the other it's 40% because बाकीचे test करू
around सारखी statistics पण this is what is we have. And average सगळ्यांचे धरले it comes to around 26%. But 40 वर्षावर धरले it is 40. It's a very high. All over India it is less around 10 to 15% सुमार असतले. All over the world it is 10%. So that means there is something basically going wrong with our diet, our exercise and other things. Is totally haywire झाला सगळं.
Stress does not play any part in
Extremely this? Important. Targets. सगळ्यांक टार्गेटां दिल्ली आहा. IT सेक्टरचे कशा भुरगे आर अर्निंग मनी. Young people, say doctors कशा डॉक्टरांचे अर्निंग starts only after the age of 40. And there whatever they earn it is spent by the children.
Okay.
And तुका टायमूच मेळना हे सगळें
Yeah,
करपाक बिकॉज यू आर
correct.
एक्स्ट्रीमली
Yeah.
बिझी. While IT sector आसा ते कशें दे आर अर्निंग एट द एज ऑफ 20, 30. They have money. That's why all these Bangalore, Pune and all these cities are there. The pubs are growing. And the night life is very high much, some cases, because of young people are having money in their hand. So ताका कितें करतले आतां? These things
Even
are
to
going
Goa,
change.
even when they come to Goa, all these IT people and most of the Goan nightlife and all, these are these very
आणि
young
पूण
boys.
आमचे दोतोर have you ever seen some doctors are going in the night life and jumping and all? टायमूच मेळना न्ही तुका हें करपाक because you are busy all the time सारको.
Sorry.
तांकां कशें जरी टार्गेट असले ताका फिक्स टायमींग आसता. वर्क फ्रॉम होम आतां नवीन कल्चर आयला तातूंत तर आनी टक्को टायम मागीर. सो यू हॅव टू गिव दॅट टार्गेट जालें की तूं मागीर काम कर न कर, इट डजंट मेक मच डिफरन्स.
So basically, तुम्ही कितें म्हणटा that lifestyle diseases have increased in Goa specifically because Goa is more affluent compared to the rest of India.
अँड लायफस्टायल डज नॉट मीन कमी कपडे घालप. थोड्यांक दिसता कितें की तूं आमगे बिकिनी घाली म्हणजे ती लायफस्टायल चेंज जाली.
No.
नो, लायफस्टायल हेज चेंज कशें म्हणजे तुजें पयलीं तूं अरावंड 20 इयर्साचेर लग्न जातालो. आयज तूं 30 इयर्सा पर्यंत लग्न जायना. एडिंग 10 years ऑफ द चलयांच्या हातून मातशे प्रॉब्लेम जाता बिकॉज द फर्स्ट चायल्ड बॉर्न बिफोर द एज ऑफ 30 युअर चान्स ऑफ गेटिंग ब्रेस्ट कॅन्सर डिक्रीजीस बाय 30%.
I see.
पण जायना आतां. तुवें म्हणलें करूंक जाय लग्न म्हणून दे वॉन्ट टू अर्न मोर, दे वॉन्ट टू बी ऑन देयर लेग्स, दे वॉन्ट टू सी दॅट नो आय वॉन्ट टू वेट फॉर सम मोर टायम. लग्नय जालें जाल्यार म्हणटलें पयलीं 5 वर्सां वी वॉन्ट टू एन्जॉय लायफ. मागीर पळोवया भुरगीं एंड स्टार्ट चिल्ड्रन एट 32, 33. So see, by the time you are 60, these are very young, ne? So you should be to retire जाता तेन्ना you should be children should settle, ne? तशें जावपाक जाय तें. पण जायना तशें.
But how cancers have risen so much like in Goa?
One is, as I told you, because of lifestyle.
Okay.
One is there. One is because of average age has gone up.
Okay.
Yeah.
So it's a normal progression.
Yeah, it is a normal progression, and our rate of cancer is on par with the all India level.
Okay.
Maybe in some cancers we are on par with the
World.
national
Okay.
big cities,
Okay.
like
Okay.
metropolis cities म्हणटा आमी,
Okay.
म्हणजे Bombay, Madras, these cities. But second tier cities, and आमी are more or less same. All over India जर धरली जाल्यार it is around 97 per lakh of population. We
Okay.
consider in cancer is in lakh of population,
Okay.
not percentage.
Okay.
India, Goa is around 100. We see around 1,500 new patients per year. Population suppose 15 lakhs धरले तुवें जाल्यार it will be approximately around 100 per lakh. So it is not very far from average of 97. Kerala is 130.
I see.
And you know how much is USA?
How much?
400.
Oh, really?
So we are much better.
Much better off.
But
But
if we don't control our diet, we don't control all these our bad habits, then it will not be another maybe 50 years we will be catching them.
But what like diet? Like तुम्ही diet म्हणता okay, but कितें म्हण diet?
One thing is
Practically speaking, in today's
practically speaking, you should have good vegetables, good leafy vegetables.
Means
म्हणजे
fresh
तांबडी
like
भाजी
salad,
तुका घाली,
salad.
मागीर मेथी
even
घाली
cooked.
आणि cooked food. आणि salad you can have, but basically cooked food is very important. And leafy vegetables, fruits if you don't have diabetes, lot of water.
So if you have diabetes, you should avoid fruits.
You should avoid. You can have only one fruit or half a fruit a day, or एक केळें खावपाचें, half the apple you can eat. But you can't go on eating full. आमी कशें खाता एक पपाय हाडली की आमी ती सोंपयता सगळी पपाय. That you cannot do because all of them contain fructose.
Okay.
So the diet is important. Red meat you should avoid. Because we see that the red meat is the main cause of colon cancer, which large intestine जे असता ताका जो कॅन्सर जाता, आणि गोवा is the worst in that. We are number 1 in India in colon cancer.
Okay.
We are best in cervical cancer. Cervical cancer has gone down drastically, but colon cancer has increased, and Goa it is the worst. Because of our almost I would say 50% or more than population likes red meat.
But regular आता इतली red meat?
नाही, पण तुझी कशा तुम्ही ते थोडे ख्रिश्चन खातात ते पोर्क आणि बीफ खातले नाही, पण बाकीचे मटन ऑल्सो इज देअर विच इज इटन बाय ऑल मुस्लिम्स लाईक द ईट मटन. हिंदूज ॲटलीस्ट 30-40% विल लव टू ईट मटन. आय ऑल्सो लव टू ईट मटन. इफ यू गिवन मी चान्स आय विल ईट मटन रॅन द चिकन. बट यू मस्ट वन्स इन अ वाईल इज ओके, बट नॉट एव्हरी डे.
Once in a while म्हणजे आता?
Maybe once a week also you can have.
It's fine.
Not be
Okay,
problem.
okay.
But every day you have,
then it's a problem.
then it is a problem. And because of that you don't have proper motions, because the constipation data, and that whatever supposed to go out remains in the body, and that's why you can get a colon cancer over a period of time.
Okay.
So that we can just by diet we can prevent so many things. Plus it gives you fighting power to very what leafy vegetables. Good exercise.
Now, what do you define? Define good exercise. Going to the gym every day, going in the
People
morning,
now
going
while
in the
doing
evening,
exercise
weights.
they have died.
Yeah, I was going to come to that. तेच
ते
होतं.
अति करतात नाही. See, you are doing exercise looking at the other man. म्हणजे आम्ही कशा पहिले आम्ही आता आवय कशा आता आवय इतक्यो स्ट्रिक्ट जाल्या ताका एक मार्क चढ पडलो हाका एक मार्क दुसऱ्यांचे लक्ष सगळ्यांचे. सो तो आता म्हणत तो हा आली तो इतके मारता सामके फास्ट चलयता गाडी ते कितें ट्रेडमिल आय कॅनॉट डू दॅट. You are trying to compete with the others.
Okay.
When your body can कितके जाता तितके तुवें पळोवंक जाय. So it is important that you should have a good trainer who should train you exactly तुज्या बॉडी वेटा प्रमाणे बाबा तुवें कितें करूंक जाय तुवें कितें खावपा जाय. ते सगळे wants to eat that high protein diet because they want to build that muscles and all. Most of them will contain some steroid or something. So these things are not good for you. So like 30 minutes walk also if you do maybe 3-4 times a week, I think that should be enough for you.
But also you need to do some weight training also so the muscle mass goes down and all. Just general weight.
that
I'm not
is-
talking about proteins and steroids, but generally
See,
क्या important
carbohydrates
असतात
are
ते?
the not good ones. Carbohydrates should avoid. That means rice.
Okay. White rice,
rice
especially
कशा
polished
आमकां
rice.
रायस नाका म्हण सांगल्यार फिश करी रायस खाल्यान जगतले कशा. बट थोडे कशा तो असो डिगारो करून ते मागीर हुमण घाल आनी रायस आनी तितके खाल्ले तशें ना. यू शुड हॅव एक बाबा इतके क्वॉलिटी ऑफ इन क्वॉन्टिटी ऑफ रायस ओनली वन्स अ डे. सांजचे मागीर दुसरे कितें पोळी बिळी तशें खाल्ली. सो यू नीड टू हॅव अ गुड डायटिशियन हू कॅन एडवायज यू इफ यू हॅव सम प्रॉब्लेम्स लायक डायबिटीज आसा कोणाक प्रेशर आसा मीठ कमी खावचें पडटा. सो these things are very important in life to have adjust to as you are इंडिव्हिज्युअलाइज जावपाक जाय. तो बाबा इतके करता तो एक्सरसाइज इतके करता म्हणून हांव इतको करतलो दॅट इज विल नॉट सफायज फॉर यू. And that's why some people die while doing exercise.
Yeah, but what I was saying is that light weights and all as you grow old are important because to keep the.
Just do walking, swimming, cycling. I think these are rather than going to the gym.
Okay.
The best thing is to go for a cycling.
Okay.
Cycling gives you good exercise for your joints. Plus, you go in a good weather. You will be going outside. You can breathe some good
Fresh air.
AC तू गच्च जावन तो घाम आयला सगळ्यांक आता तातूंत तू ते एक्सरसाइज करता. त्यापेक्षा स्विमिंग is best सारखे because it every muscle in your body is being used in the swimming.
Okay.
And walking normal. And the walking म्हणजे कशा you should be having brisk walking.
Okay.
मातशें स्वेटिंग जावपा जाय.
Okay.
आनी बरें हात बीत हालोवपा जाय. हांगा कशें तूं खबऱ्यो मारीत तुवें आयज कितें नुस्तें हाडलें तुवें आयज कितें केलें गे हांगा कोणें केलें हांव आज बिजनेस हांव वचना आयज वाज येता म्हाका हांगा हें वाज असल्यो खबऱ्यो करीत जर तूं चलत गेलो जाल्यार काय करूंक पावना. सो यू मस्ट बी कॉन्सन्ट्रेटिंग सारकें वॉकिंग फास्ट and एक around 2 किलोमीटर वचपाचें 2 किलोमीटर 4 kilometers alternate day also you can do and सूर्य नमस्कार बी घालप that is okay.
Stretching and all important.
Yeah, stretching him.
Yoga.
My wife does around 111 Surya Namaskar every day.
Really?
Every day.
But that's
for last month 15 years. So I do exercise. I just look at her and think that I am doing exercise. I can't do
But
that.
100 that is like.
I do only corporate push-ups.
Okay.
Corporate push-up म्हणून आसा म्हणजे सकाळी ते हांव अशें धरप बिनतेक and then you do.
Okay,
If you
okay.
lie down, I will not be able to lift myself up. But see, remaining happy is ultimate.
Is important.
ते स्ट्रेस मातशी लेवल तुवें कमी केली तुजी घाई करून ना. You should know how to handle your stress.
That's what.
You should know how to handle your resilience. Your resilience power वाडोवपा जाय तुवें. नाल्यार म्हाका टेंशन आहा. See, sometimes doing work is also tension, but I love that tension. I can do multitasking things. म्हाका IMA चे काम आसा, म्हाका मणिपालाचे काम आसा, म्हाका घरा कडेचे काम आसा. So I can handle everything. But not everybody cannot handle such time. ते म्हणून I am stressed. परिकाराक हांवें एकदां विचारलेलें तूं इतकें काम करता म्हणल्यार त्यो फायली. तो म्हणटा if I don't have files, I am stressed. तो म्हणटा ती फायलीर बरोवपाक जाय
he was the ultimate
ते ना
multitasker.
जाल्यार म्हणटा हांव आपूण कितें करूं काय म्हणून. सो एवरीबडी हॅज सम सॉर्ट ऑफ स्ट्रेस इज देर. अँड आमचे इंडियन मेडिकल असोसिएशन दिस इयर वी हॅव टेकन बी कायंड टू युअर मायंड.
म्हणजे
बी कायंड टू युअर मायंड.
Yeah.
कीप युअर मायंड हेल्दी.
Okay.
काय न्ही हाऊ टू हँडल द स्ट्रेस. वी टूक रिसेंटली फॉर द ऑल जजीस अँड हायकोर्टात जजीसांक हाऊ टू हँडल द स्ट्रेस ॲट वर्क प्लेस.
Okay.
Everybody has got a stress. Different type of stresses are there.
Yes.
थोड्यांक घराचे असता, थोड्यांक कामाचे असता, थोड्यांक टार्गेट्स असता. कळ्ळें न्ही. सो दीस थिंग्स आर देर बट इट्स यूज टू बी अ पार्ट ऑफ युअर लायफ. तूं ते घेवन अड्ड्यार बसलो आनी तें टेन्शन घेवन बसलो प्रत्येक दॅट वील कॉज युअर मोर हार्म बिकॉज युअर फायटींग पॉवर गोज डावन. ते टी सेल बी न्हिदतात तुजे ते सगळे स्ट्रेसान. सो यू नीड टू गीव दॅट एक बाबा ताका पॉझिटिव्ह फिलींग दिलें जाल्यार आमी अशें इवन स्टडीज हॅव शोन दॅट इफ यू आर पॉझिटिव्ह टुवर्ड्स अ कॅन्सर एंड ऑल युअर सर्वायवल इम्प्रूव्स.
So positivity is
Positivity
important.
is extremely
That's what you're
important.
saying.
Yeah, extremely important. And the way you behave in a society, the way your happiness is there, your happiness, you are all the time, even तुका कितें त्रास आसा कळ्ळें न्ही जाल्यार सुद्दां तूं हॅप्पी आसता इज व्हेरी इम्पॉर्टंट. सी म्हणजे समटायम्स you feel that only money can buy something. Nothing cannot buy anything. So money can buy you only some good cars and all, but the mind, because sometimes we feel that you don't have money, but she comes smiling to you, patient. जिकडे 100 रुपया ना तुका दिवपाचे. I was telling recently to my friend, she brings me every time she comes, she brings me some vegetables. हिका 100 रुपया दिवपाक ना, पण ती म्हाका सदांच भाजी हाडटा. हांवें जस्ट पाखाणांनी म्हणलें आगे हांव भाजी खायना कितें, भाजी म्हणजे बायलूच खाता, शी इज वेज. हांवें म्हणलें ना तुका कितें जाय काय म्हणलें. हांवें म्हणलें कांय नाका म्हाका, तूं यो म्हणलें. ना कुले हाडटा म्हणलें, कुले आतां ती कुले न्ही ते बारीक रॉ पणस. हांवें म्हणलें बरें हाड म्हणलें. खंयसून हाडटलें गे तूं काय म्हणलें. ना ते बाजारांत म्हणपा लागले विकतात म्हणपा लागले. जस्ट इमॅजीन म्हाका म्हणलें 50 रुपया पडटा ताका. शी इज गोईंग टू बाय दॅट कुले अँड गीव मी वेन शी कॅनॉट एफोर्ड हर डे टू डे मील. ती जेवतली काय ना फाल्यां तिका खबर ना. This is what is called as happiness
and attitude, no?
And she is happy to give somebody something. I am not doing any big service to her. I am doing it under Deen Dayalchi scheme आहा आमचे कडेन in Manipal Hospital. We must have operated now around 25,000 तरी patients procedures. We have done totally free under because of scheme is there.
Okay.
So that's why we can operate on the even lower section of the society. Otherwise आमच्या हॉस्पिटलान तुका ती only our people will feel that only वयरसून येऊ शकता म्हणून. But because of this scheme, we can reach out to the.
But DDSY, many things you cannot do under that. They're going to improve
but
that. But
important things which are there, which are day-to-day life. All types of cancers we can operate. All types of cancer we can operate.
Okay.
Only thing, ते जर लॅप्रोस्कोपिक करतलो तूं किंवा ते रोबोटिक करतलो then you will have to pay. But open surgeries, every cancer surgery you can operate. Radiation is free. Chemotherapy, most of the chemotherapies are free. See, you have to understand in cancer, more expenses are for the advanced patients.
Fourth stage, fifth stage.
If you come in time under DDSY, you have to spend not more than 50,000 rupees for all your treatment.
I see. Which is very reasonable, I think.
50,000 and they be over a period of 6 months. But if you came in stage 3 and 4, Magir tuka there is no dearth of, because the new medicines which have come is all for advanced patients. And they are so costly. म्हणजे महिन्याक 3 लाख 4 लाख.
So expensive.
And you have to take for lifelong.
Oh God.
You don't know how long you are going to survive. So the maximum expenditure is for later part of this.
Senior.
So if you come in time, so in this what I am trying to show, early diagnosis saves life, saves money, at the same time saves your organ. We don't have to remove the full breast.
Especially with
so
the
it is a big this for on all fronts. So it is very important that you must come early.
But to me in Manipalan you all had done some breast, some detection, some new technique, something
No, that we have. We had that eye breast before also.
Okay.
We are doing. We have a mammography. We have got everything.
Okay.
Some case थोडे early हा that the wire localization करता. मी कितें sometimes you cannot make out also very soon micro calcification भी हा. Wire असे perpendicular घालून we localize and only that much part we can do. We are conserving the breast as much as possible. Vocal cordaचे बी आसा जाल्यार बरी रेडिएशन दिवन we can म्हणजे पयलीं आमकां सगळी काडचे पडटाले. म्हणजे वॉयस वतालो तुजो, मागीर हांगा तुका श्वास घेवपाक आसतालो. ऑल दोज थिंग्स कॅन बी व्हेरी मच कट, बट प्रोवायडेड यू कम इन टायम. सी दॅट इज द क्रक्स इन कॅन्सर.
Correct.
तूं सुशेगाद येतलो आनी जातले, इट इज नॉट पॉसिबल.
Another point, Doctor, I want to, before I go to the last, I want to know this, for suppose if, as you said, Goa has very high level of diabetes, among other things. Now, what is the advice for a person who has got diabetes, but early stages, later stages, कितें करपाचें? Otherwise,
बेसिकली कशें पयलीं म्हणजे you have to do your checking. एटलीस्ट वर्सान एकदा तरी तुवें चॅक करूंक जाय. वन्स यू नो दॅट, आमी कितके पळयता, आमी कॅम्पाक वता न्ही, एटलीस्ट 10-15 जाण तरी फर्स्ट टायम डायबिटीज डिटेक्ट जाता.
फॉर द कॅम्प्स.
फॉर द कॅम्प्स. नॉर्मल खबर आशिल्ले ते येता, ते कळटा आमकां न्ही की ताका खबर आहा आपल्याक आसा म्हणून. पण जाका कोणाक कांयच खबर ना ताका सुद्दां आमी केन्ना केन्ना अशेंच रेग्युलर आतां कॅन्सर जालो म्हणून आयलो आनी टेस्ट केली जाल्यार तुका डायबिटीज आहा म्हणून कळटा. सो गव्हर्मेंट इज डुईंग लॉट ऑफ ऑन डायबिटीज फ्रंट. आनी ते नवीन हाजे कडेन सिग्नेचर केल्या. दे हॅव सेंड नर्सीस फॉर ट्रेनिंग, दे हॅव सेंड डॉक्टर्स फॉर ट्रेनिंग. दे हॅव अपॉइंटेड अ कावन्सिलर डायबिटीसाचे, म्हणजे कशें डायट घेवपाचें, ते पांयाची कॅर कशी घेवपाची. सो एवरी प्रायमरी हेल्थ सेंटर लेवलचेर देर इज अ डायबिटीक.
I see.
So
That's
it's a very good thing what you
Yeah,
have, and they are giving insulin at the primary center level. Insulin actually is the best drug, but problem हा लोकांक ती घेवन मारप, nobody wants to. The compliance is much less सारखे. So tablets लोकांक बऱ्यो पडटा घेवपाच्यो, and lot of people are doing alternative therapy also, Ayurvedic, homeopathy तेय करतात,
It
but
works?
they should be, I don't know it works or not, but they feel little relaxed. पण प्रॉब्लेम कशा ते तूं एकदां, दिस शूड बी परमनंट लायफस्टायल न्ही. तूं एकूच दीस ते डायट करतलो आनी मागीर म्हणटलो पर आतां कमी जाली आपली, जालें आपलें, चल परत आपलें खावंक लागुया, तशें जायना न्ही. इट इज अ परमनंट लायफस्टायल तुजी चेंज केली जाल्यार ती डायबिटीज कॅन रिवर्स नाव. म्हणजे पयलीं आमकां दिसताली डायबिटीज म्हणजे वन्स डायबिटीज जाली की लायफ टायम डायबिटीज म्हणून.
This is reversible.
नाव इट इज रिवर्सिबल प्रोवायडेड यू डू ऑल दोज थिंग्स प्रॉपरली. तुवें सारकें डायट ती कितकें घेवंक जाय, चपाती इतकेच खावंक जाय, इतके खाल्ल्यार इतके खावपाचे, इतके बदाम खावपाचे, इतके हे रायस खावपाचो. थोडे कितें करता, रायस म्हणटा बरें न्हय म्हणटा आनी चपाती खाता. वॉट इज द डिफरन्स बिटवीन रायस आनी चपाती? सो इट इज सेम. सो हें कशें हें तूं एक्चुअली भितर पावलें, ताजे एक्सपर्टा कडेन गेलो की तुका कळटा. नाल्यार आमी कॉमन मॅन असो कितें म्हणा, रायस न्हय, ओके सकाळी म्हणा सकाळची आपूण रायस खाता म्हणटा रातची आपूण चपाती. सेम न्ही.
And otherwise they eat bread and whatever.
ते सगळे ऑल इज मैदा ओनली नाव.
But
पयलीं
पोळी-
कशें पोळी येताली न्ही, ती कुण्याची येताली पयलींच्यो पोळी. आतां म्हाका दिसता आय एम डाउटफूल इफ एनीबडी डज दॅट, बिकॉज ते सगळे भायलेच करतात लोक. आमचे सगळे लोक फक्त गव्हर्मेंट जॉब. ओरिजिनल आमची जी एक हे आशिल्ली पोळयो करपाची, कांकणां करपाची, दोज थिंग्स आर खंय मेळटा तुका. आय एम नॉट शुअर दॅट वॉट आतां पोळयो मेळटा त्यो दे आर कुण्याक काय आनी कित्याच्यो त्यो. बट एक डायटिशियना कडेन तो दोतोर आहा जो आमचो फिजिशियन, एवरी फिजिशियन नाव मस्ट लर्न हाव टू एडवायज फॉर डायबिटीज, बिकॉज डायटिशियना कडेन वचप इज नॉट इजी नाव.
Yeah, tough it
आनी
is.
मेळनाय तुका कोण अशें. सो जीपी जे आसता दे शूड ऑल्सो लर्न हाव टू गिव डायरेक्शन टू द पीपल. तांकां डायबिटीज आहा तांकां बाबा कितें डायरेक्शन दिवपाचें, आनी दॅट इफ यू डू स्ट्रिक्ट दॅट यू कॅन रिवर्स द डायबिटीज.
That's not bad. Another thing, one thing which is we have seen, suddenly you find people, even when you talk to doctors and all, 20, 25-year-olds, heart attacks, 30-year-olds dying of heart attacks. Now, what is this new trend? It's a very scary trend, right?
No,
for
it's
the
a
youth.
scary trend. We have seen so many people, even young people, suddenly falling while doing
Yeah.
exercise, cricket
No,
खेळटाना
even
गेले.
yeah.
These things we have seen so many आता हालतून. After COVID it has become much more evident सारखें जाला. COVID was known to be a thrombogenic. म्हणजे I remember today also one of my friend, I operated that time. He had full intestinal gangrene सारखे.
I see.
Small intestine, the small vessels also had a thrombus inside.
I see.
So it is important that that means it was thrombogenic some disease. ते थ्रोम्बोजेनिक म्हणजे तुका जाता ते प्रॉब्लेम म्हणजे केन्ना फुडें जावंक शकता. एकदां जालो तुका ते इट इज अ व्हायरल आनी वी डोंट नो वॉट इज लॉंग टर्म इफेक्ट्स. पल्मनरीचेर लंग्साचेर कितको इफेक्ट जाल्लो आसा, वेसल्सांचेर इफेक्ट जाल्लो आसा. बेसिकली इट वॉज अ इन्फ्लमेशन ऑफ द वेसल्स. कोवीड म्हणजे कितें जाल्लें, इन्फ्लमेशन ऑफ द वेसल. सो आय फील दॅट यू हॅव टू बी टेकिंग अ नॉर्मल केअर. अति सामकें करपाचें करना. इफ यू हॅव अ व्हेरी सिवियर तुका कोवीड बी जाला जाल्यार तुवें दोतोरा कडेन वचून आपली बाबा एक्टिविटी कितकी करूं शकता आपूण. कॅन आय डू माय ECG सारको करूंक जाय, वर्सान एकदां ECG कर, एकदम इको कर. रेग्युलर टेस्टिंग इज इम्पॉर्टंट. टेक युअर डॉक्टर्स फिजिशियन्स एडवायज ऑन दीस अँड डोंट ट्राय टू डू टू मच ऑफ एक्सरसायज अननेसेसरी. ओगीच सामकें खर्चून सामको अशें घाम येवन सामको मरूंक पावल्या भशेन तसलें करपाची कांय गरज ना. बिकॉज यू कॅन कीप युअर सेल्फ हेल्दी विथ सिंपल रनिंग एंड ऑल. न्हय.
And proper diet.
Yeah, proper diet. But we know that there is number and people are putting it in the name of COVID and mental vaccine. It's not because of vaccine, it's because of COVID itself. COVID disease itself is the cause of all these things.
So possibly that also, and maybe again lifestyle also, no?
Lifestyle is
Diet
adding to that.
is adding.
तुका कोविड जाल्लो तातूंत तूं हें चिकन मटन सगळें खातलो, तातूंत ती ऑयल खातलो सगळी आनी ते करतलो आनी देन यू एक्सपेक्ट एवरीथींग टू. प्लस थोड्यांक कशें थोड्यांक ओरिजिनल जेनेटीक प्रॉब्लेम आसता, कार्डिओमायोपॅथी आसता. यंग पेशंट दे डाय, एथलेटिक्स दे डाय, पीपल इन एथलेटिक्स. दिस बिकॉज ऑफ कार्डिओमायोपॅथी म्हणून एक डिसीज आसता, ती आसता तांकां. तातूंत ते सडनली हार्ट तुजें कॉलेप्स जाता सारकें.
Possible. Also now, two things, like we are almost out of time, but I just wanted, now many people work late, right? But working late in a normal atmosphere and going out pubbing and like late nights, to places, that there is a difference, is that, or both are as bad?
See, you should be happy. सोरो पिता जाल्यार मातसो कंट्रोलान पिया सामको. No पिवप is best, but at least control करा. Wine is considered a little better than the alcohol. But it is like you want to die of AK-47 or you want to die of a pistol. So you have to decide what you want. ताजेर तूं सिगरेट ओडटलो, ताजेर तूं सोरो पितलो, ताजेर तूं ते चिकना मटना खातलो. Then you are hitting the right spot of your वयर वचपाचो सारको.
Correct.
But important is after good drinks सुद्धा घेतली जाल्यार you should have good food. Then you should have good sleep. At least 6 hours sleep is must.
But even if you sleep late, you have to sleep.
Sleep. 6 वरां तुका रेस्ट जाय. Suppose तुवें 5 वरां रातचो न्हिदलो, at least दनपारां 1 hour. And now they have proved that after, तुवें आमी म्हणटाले सुशेगाद लोक म्हणून. Now it is scientifically proved that half an hour nap in the afternoon
It's very good.
is good for your health. Half an hour. हांव गाडयेन न्हिदता. Best is car. My driver is driving. When I also drive, sometimes I sleep. Many accidents like that. That's why now I am taking driver with me. But best part, once I just sit in the car, just relax. एक वर घरा कडेन पावपाक, I just relax.
You still
Bichole.
You still say, yeah.
I can't leave my hometown. I'm all for my people.
yeah. Okay, thanks a lot, Dr. It was a pleasure, and hopefully we can do this a little more often. I want, because these things have to come out in. It's not that most people are not aware. The awareness na, or even who is going to read. So if something like this comes out, possibly we can do it.
थोडे awareness आसाय आनी तेही करता.
They also there, no doubt. I will not share this with you. Thank you again, Dr. This was Dr. Shekhar Salkar, a very senior and eminent doctor from Goa, and is known all over the places. And hopefully we can take some of the lessons that we've heard here and try and inculcate it in our lives. Any which way, choice is yours, as doctor said. Thank you, and keep watching Goa 365.